Yeah, so thank you, and thank you to Bill, who has been such an amazing supporter of Flint and our work, especially our recovery work. So thank you for having me. I know I've tried to be here for like 3 years in a row. It worked out this year. So thank you for you and the board and everybody who is part of Less Cancer for the incredible work that you do. And thank you for all the guests and the staff members and whoever else might be here to participate in this day, to learn more about what Less Cancer does and really kind of what the role that everybody can do to make the world free of preventable disease and exposures. Shout out to the student. Where was that student? You're awesome. Good job. So my main hat is an educator, and it's all about you guys. And your talk inspires me and should inspire all of us. And look, all these young people over here, high school students, right? I heard about, or college students, medical. Oh, really important older students. Awesome. So you guys are all incredible. So thank you for your work. Thank you for your curiosity. Thank you for your courage to tackle these, hard questions. And most importantly, for sharing your science. Scientists and doctors, and academics, we do a terrible job sharing our science. And often our science ends up in like journals and publications that nobody reads. And we like stumble and we don't know how to talk, and we're not good advocates for our science. So thank you for being that great communicator, and sharing your science and really the critical work that you are doing that hopefully more folks can do. So I just want to kind of share a little bit of kind of the Flint story, but really share kind of where we are right now. And I brought my water bottle because I'm thirsty, but also to share that Flint's still on bottled water. So a lot of you thought that Flint was probably taken care of, that was a old story, that was something from a few years ago. But to this day, Flint is still on filtered and bottled water. We have made tremendous progress in our water quality. Our water is much better than it used to be. But Flint is doing this massive infrastructure project. We're replacing our lead pipes. And when you do that infrastructure work, you disrupt all the gunk that is in those pipes, especially that lead scale, and that can increase the risk of lead release. So that should be done hopefully by this year, and hopefully we'll get the all clear, and our water will hopefully be safe again to drink. And I put safe in quotes because over the last few years, what I have learned about drinking water, and especially the regulations that are on the books, is that they're weak and that they're lax, and they have not caught up with the incredible science to date of different toxicities and chemicals and what we need to fully protect the health of our populations, especially our most vulnerable populations like children. So I don't say water is safe in Flint or in DC or really anywhere anymore, because there's so much work that needs to be done in the policy arena to strengthen the regulations, to really use the concept of something in public health we call as the precautionary principle, where we protect folks before we see proof of harm. So there's a lot of work that needs to happen there. A quick recap kind of in terms of what happened in Flint and why this became such a national story. So who hasn't heard of the Flint water crisis? Okay, do you remember seeing those pictures of literally brown water coming out of people's sinks? I didn't even believe it at first. Brown water was coming out of people's sinks. So Michigan has this crazy law, which is still in the books, called emergency management. And that law said that if a city was in financial trouble, we would take over the city and we would run the city and cut costs. So Flint has been in crisis really for decades and lots of financial trouble. So in 2011, we became under the control of an emergency manager. And that guy had one job, then there was a series of them, and it was really austerity. It was to save money. And they had decided that the water that we were getting from the Great Lakes was too expensive for this predominantly poor minority population. And instead, we would start drawing water from the Flint River until a new pipeline was to be built. So I know there's a few Michiganders in the audience. Anybody from Michigan? Yeah, it's quite a few. So point to me where you're from. We do the mitten thing. Awesome. You did this earlier? Awesome. So we are the mitten state because what are we surrounded by? What's Michigan surrounded by? Great Lakes. So we're surrounded by the largest source of fresh water in the world. 20% of the fresh water in the world is around Michigan. Yet to this day, we have a population of people who are predominantly poor and minority who do not have access to that fresh water. So in this austerity-driven move and this corrosion of democracy, Flint switched their water source to the Flint River. As a temporary move, it was to, the long-term plan was a plan that we were going to move to a new pipeline. And the Flint River water, the problem was it wasn't treated properly. So they forgot or never wanted to or didn't for some reason add an important ingredient called corrosion control. And to me, as a doctor, I think of it like a medicine that you put in the water treatment to prevent whatever's in the pipes from coming out of the pipes and into the drinking water. And before all this, like I as a doctor, never even thought that you could have lead in your water. And I had been practicing in Flint for years and before that in Detroit. And when I was a trainee in Detroit, there was never a day that didn't go by that I didn't take care of a patient who was admitted to the hospital with lead poisoning. And we would take these really thorough histories and we'd ask, like, how old is your house? And do you eat the chip paint? And do you get, what are your parents' hobbies? Does anybody work in stained glass? And all, I'd ask, we'd do these differentials, like what could be causing this kid's lead exposure? And I never even thought as a doctor that you could get lead from water. So my amazing students over here. So what is the elemental symbol for lead? Pb, which comes from the Latin plumbum, which means plumbing. So lead actually means plumbing. And I had no idea that the word lead actually means plumbing. The Romans, when they built their aqueducts, they used lead plumbing. And there's actually strong theories that hypothesize the demise of the Romans is because they used so much lead in their plumbing. They also put lead in food, which is a bad idea. So ever since the advent of the use of lead in plumbing, people have had issues. It's probably the most well-studied environmental toxin. Like there's articles about lead's toxicity from centuries ago, what lead does. And increasingly, over the last few decades, science has taught us so much more. Science has taught us that levels that we thought were okay decades ago, when we had lead in paint, when we had lead in gasoline, are no longer okay. And we now know that there is no safe level of lead in the human body because of what it does to especially children and really their entire life course trajectories. So it is a potent, irreversible neurotoxin that attacks the core of who you are. It impacts cognition, so actually drops IQ levels. It impacts behavior, leads to things like developmental disorders and attention deficit disorders and behavioral problems, and it's even been linked to criminality. And we increasingly, with new research, kind of learn more and more about what lead does. Its epigenetics, how it can impact future generations. We also know that lead impacts adults and leads to things like high blood pressure, hypertension, kidney disease, early dementia. So it has one of the strongest research bases behind it. Yet as a nation, we were stubbornly slow to listen to science. And it wasn't until 1986 did we restrict the use of lead in plumbing, in lead service lines, which are the water lines that go from the water main to the front of your house. And get this, not until 2014 did we restrict the use of lead in fixtures, like brass fixtures and faucets. So I share that, Flint schools had some of the highest water lead levels in the thousands and thousands of parts per billion. They didn't have any lead lines, but it was their fixtures that were corroding lead and their faucets and the drinking fountains that were getting into our drinking water and getting into the bodies of our children. So for 18 months, lead was really flowing freely into through the drinking water system in Flint. Throughout this entire time, the state said, hey, everything is okay. Everything is in minimal compliance. Relax. Patients were coming to see me as a pediatrician, asking me, should I be mixing my baby's formula, which is a powder, with tap water? And I was saying, of course, why would you waste your money buying bottled water? Of course our tap water is safe, because it's America. It's the richest country in the history of the world. It's the 21st century. So in my book, I take a lot of dives into history. I talk about the cholera epidemics of old London. We've come a long way. Like, civilizations are built on the delivery of safe drinking water. It's the Great Lakes. We're surrounded by fresh water. But despite all that, there's rules and there's regulations and there's people who wake up every day to make sure that when we turn on our tap, no matter how poor our city is, no matter the demographics of our population, that it is safe to drink. So that changed all entirely for me when I heard about the possibility of lead being in the water. Any pediatrician, any person with a public health background, when you hear the word lead, you freak out because of what it does to children's cognition, behavior, but also because we know it's a form of environmental injustice. It's a form of environmental racism. Our kids in Flint already had higher lead levels because of legacy lead exposure and poor nutrition and deteriorating infrastructure. But just like kids in Detroit and Chicago and DC and Baltimore and Philadelphia, so it already impacts our most vulnerable children who are already struggling with every obstacle to their development. So when I heard about the possibility of lead in the water, there was really no going back. And we did the research in rapid speed, which you can read about in the book. So Oprah put this book on her summer reading list, and it said it had the gripping intrigue of a Grisham thriller. So who knew science and research could be so exciting and a page turner? So enjoy it. But then very publicly shared this research. So when you do research, all the academics in the audience, when you do research, how do you share your research? Scientific articles, publications, presentations. How long does that take? Forever. So you have to go through this peer review process, which is a really important thing in science. However, it takes forever. And I literally walked out of my clinic, stood behind a podium that was taller than this, and you guys learned I'm really short, so you couldn't even see me, and shared this research because our kids didn't have another day. And really, since then, have been working in our recovery, which is really building a model public health program to mitigate the impact of this exposure. We can't take this away. There's no cure. There's no antidote. We failed at primary prevention. So our focus now is secondary prevention. What can we do to really wrap our children with every evidence-based development promoting intervention? So right now in Flint, we have things like 2 brand new childcare centers and massive investment in early literacy. Places like Flint, there's a deficit of children's books. There's about 1 book for every 300 kids. By the time our kids reach the age of 3, they've heard 30 million less words. By the time they hit kindergarten, the achievement gap is already there. That's almost impossible to bridge. So now in Flint, we have something called the Imagination Library Program, which they have here in DC. Every kid in Flint gets a book mailed to them every single month. We've mailed 70,000 books. Pretty amazing. We have expanded Reach Out and Read, which is another evidence-based, clinic-based program. We've given out 40,000 books there. We have a brand new Born to Read program where babies born at the hospital get a bundle of books and signed up for these programs. We just celebrated our 1,000th baby in this program. So this is one example in terms of early literacy. Medicaid expansion, thanks to the federal government for Flint. Mindfulness in our schools. Our kids in schools do yoga and meditation. Holistic lead elimination programs, thanks to Medicaid CHIP dollars. School health services. We used to have 1 school nurse, and now we have over 10 school nurses in Flint. So a few of kind of the wraparound things that we've been able to put in place to really promote the development of our children. And the story of Flint is really not an isolated story. And through efforts like the Flint Registry, which actually just launched a couple of weeks ago, which is a massive CDC-funded registry modeled after things like the World Trade Center registry. We are identifying folks that were exposed. We're getting them, most importantly, connected to these resources to promote their health and development and to follow them long-term. But through things like that registry, in our very academic, data-driven hats, we hope to share our best practices with communities everywhere. Because Flint may have been kind of the most media to the city, but there's communities all over and places all over that are suffering from significant environmental contamination, that are suffering from really every single obstacle you can imagine to the success of their population, especially their children. So we hope to share our best practices with these other communities and continue advocating at the state and the national level for the policies to strengthen a lot of the regulations, to really advocate for things like primary prevention. We shouldn't have to do decades of painstaking research on one chemical substance to get that substance banned. We should really be all operating with the mindset of precautionary principle and to do no harm, especially when it comes to our vulnerable populations. So that's kind of where Flint is right now. Lots of really positive ripple effects from our work, but really, this present day example of what can happen when people who are charged with protecting children, protecting public health, protecting the environment, really fail and look the other way. But what we're hoping to share, and especially kind of the messages of my book, the title is What the Eyes Don't See. It's about kind of lead and water we don't see. It's invisible. It's colorless. It's about lead being a silent pediatric epidemic. We don't see the consequences right every day. But it's so much more than that. It's about people and places and problems that we choose not to see. And it's really easy not to see environmental health issues because sometimes they don't present for years, decades, generations later. But really our obligation to kind of open our eyes, and not only open our eyes, but to act on these injustices. So I think I will end there. I once again want to thank Less Cancer and especially thank Bill for his tremendous advocacy and support. Thank you.
It's so inspiring. It's really inspiring.
He's tall.